Hi, my name's Maggie, and I'm going to be performing a gastrointestinal, musculoskeletal, and neurologic examination on my patient, Catherine. Catherine, I'm going to be explaining to you everything I'm doing, and you just have to follow my directions. We're going to start with Catherine's general appearance. She's overall good general appearance. She's alert, good mood so far, and her skin color is appropriate. I'm going to have you lay down. We're going to start with our GI exam. First, I'm going to start by examining her abdomen. Her skin is symmetric. There's no distension or peristalsis noted. I'm going to begin by auscultating her bowel sounds. Normally, you would listen in each quadrant for 2 to 5 minutes. For the purpose of time, I'm going to listen quickly. Normally, normal tonic bowel sounds, you'll hear 5 to 35 per minute. She has positive bowel sounds. And now I'm going to auscultate her aortic, renal, and iliac arteries for any bruits. No bruits were heard. I'm going to start by percussing all 4 quadrants. So tympanic sounds are heard, and only dullness is heard over her organs. We're going to start by percussing her liver. So you go up from the bottom right quadrant until you hear dullness, and then you percuss over. Then we would normally percuss the spleen, but the spleen is under these ribs, so it cannot be palpated. But we can try to percuss it. There is dullness heard. Okay, and now I'm going to lightly palpate. Any tenderness? Okay, and we're going to do deep palpation. No irregularities are felt. I'm going to palpate the abdominal aorta. Her width of her abdominal aorta is normal. If it was greater than 3 centimeters, then it would be abnormal. We're going to palpate the liver border. So you're going to take a deep breath in. Good. And the liver comes down and meets my fingers. I'm going to palpate your kidneys. Good. And then, as I said before, I tried to palpate the spleen, but it's really under the ribs, so it cannot be palpated. So now we're going to move on to the musculoskeletal part of the exam, and we're going to focus on the upper extremities. So we're going to inspect the clavicles. They're both symmetric, no skin discoloration. Her scapula and her back, just going to palpate them. They seem even, and her shoulders are nice and even, and they're relaxed. Okay, I'm going to palpate her joints, any tenderness. I'm doing this side. Okay, and now we're going to do range of motion of your neck. So just look down and back, and to the right and the left, and bring your head down to the side. Like this way, good, and the other way. Any tenderness? No. Okay. Now we're going to do the range of motion of your shoulders. So you're going to bring them up by your ears and down and roll them forward and back. Any tenderness? Okay? And now we're going to do the elbows. So you're going to go like this, perfect, and bring your arms down and up. Good. Any pain, tenderness? No. Good. Okay, now we're going to do your reflexes. So hold your arm out for me, bicep. tricep, good. Good, your arm did a little flick. And the brachioradialis. So it's right on your wrist, good. On the other side, perfect. And lastly, your tricep, good. Good, okay. And now I'm gonna palpate the pulses. So we're gonna do your brachial, good, +2, and your radial, good, +2. The other side, +2, normal finding, radial, +2, normal finding. Now we're gonna do the range of motion of your hands and your wrist. So just do circles in your wrist for me. Good, up and down, pain, tenderness, open and close your hands. Comfortable, perfect. So now we're moving on to the lower extremity musculoskeletal. I'm gonna palpate Catherine's hips. I feel the bony prominences, feels normal. And we're gonna do the range of motion of her hips. So you're gonna bring your leg out towards me. Good, abduct and then adduct. And do the same with the other leg. Good, and bring it back in. And then do this leg, bend your knee 90 degrees, any pain. We're gonna internally rotate, externally rotate, good. And we'll do the same for the other side. Internally rotate, externally rotate, good. Pain, okay. So now I'm gonna pull up her pants. We're just gonna look at her knees, her lower extremity. There's no swelling, symmetric on both sides. Any pain when I palpate? No. Good, okay. And then we'll do range of motion of your knees. We just did similar with the hip, but like in and out, this way, pain, okay, in, out, in, twist a little bit, pain, okay. Now we're gonna move on to your ankles and your feet. No swelling again, symmetric in appearance, very good. Range of motion, just rotate your ankles for me, and in, good, and do up and down with your feet. Pain? No. Okay. And now I'm gonna palpate your pulses. Just bend them so we can get it in the picture better. Good, 2+ pedal pulse. Good, and then I'm gonna do posterior tibial artery. Good, again. Good, full 2+. And now I'm gonna have you move to the chair so that we can do the rest of your lower extremity, okay? Okay, so to finish with our lower extremity musculoskeletal, we're just going to test the patellar reflex. So I'm gonna hit under Catherine's knee, good, and again, good. So that's a positive reflex. And now I'm going to look at her spine and her posture. Sit up straight for me, good. I'm gonna palpate the spinal column. I'm going all the way down. Good. I'm gonna palpate the back muscles. Good. Everything feels normal and there's no tenderness, correct? Yeah. Okay. You're gonna stand up for me and you're gonna roll all the way down and touch your toes. Do range of motion to your spine and roll back up. Good. Any pain or restriction? Good. Now you can sit back down. We're going to do the neurologic part of the exam. We're going to first do rapid alternating movements. So you're going to put your hands on your knees and you're just going to flip them up and down for me. Quick. Good. You can stop. Now you're going to take your right foot and put the heel of your right foot on your left shin at the top and drag it down. Good. And do it on the other leg for me. Good. Normal finding, no issues. Okay. Now we're going to test the exteroceptive superficial pain and temperature. So just roll up your sleeves for me and hold your arms out. And you're going to close your eyes. And you're just going to tell me, do you feel the prick?
Yeah. 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 Yeah.
Okay, so good. And now we're just gonna do temperature. So close your eyes, you're gonna tell me if it's cold or warm.
Cold. Warm. Warm. Cold.
Awesome. Now we're testing for proprioception. So you're gonna put your fingers out for me. You're gonna tell me, you're gonna close your eyes and you're gonna tell me if I'm moving your finger up or down.
Up. Up. Down. Down.
Good, and I'm gonna do the same with your toes.
Up. Down.
Good. Okay, and cortical sensation is the next test. So I'm gonna put something in your hand and you're gonna identify the objects for me. Close your eyes and close your hand around the object and tell me what it is.
A coin.
Good, and the other hand.
Paper clip.
Good.
Coin. Paper clip.
Good. Okay. So that is stereogenesis, and there was normal findings. She could identify the objects. Now we're going to do graphitasia. You're going to open your hand and you're going to tell me what letter or number I write on your hand.
S. 8.
Okay, good. And
A.
perfect. To test the reflexes of the feet. So we're going to do the Achilles tendon. Back up for me just a little bit so I can see the back of your feet in the picture. Good. I'm going to hit back here. Good. And the other foot. Good. And her foot does a flick down. Now hold your foot up for me. Go like this. Good. And that's the correct response. Dull object and your foot crawls around it. Perfect. Now we're going to observe your standing and walking. So stand up for me. Take 2 steps forward. You're standing normal. Your walking's normal. Take 2 steps backward for me. Walk on your heels for me. Just 2 steps. Perfect. And on your tiptoes. And then you can just go in that direction and heel to toe. Good. And come back. And 2 more tests. We're going to do the Romberg sign. So you're just going to stand feet together, arms at your side. Good. She has no swaying. Close your eyes. Good. No swaying is found. So no Romberg signs present. Now you're going to put your arms out for me, palms up, and close your eyes. Good. And she has no pronator drift. Perfect.